Forced to work from home by your employer? Laid off or feeling depressed at home? Do you want to make money working from anywhere? We'll show you how to do it from your couch. It's time for another episode of the Work From Home Show. Coming to you from their homes in Austin, Texas and Tampa, Florida, here are your hosts, Adam and Naresh.
Hey everyone, welcome back to another episode of the Work From Home Show. I'm Naresh Vissa with Adam Schrader, and today we have Adia Harvey Wingfield joining us on the show. She's actually Dr. Adia Harvey Wingfield. She's a professor of sociology at Washington University in St. Louis, otherwise known as WashU St. Louis, president of Sociologists for Women in Society, which is a national organization that encourages feminist research, and author of multiple books, including No More Invisible Man, Race and Gender in Men's Work, and the new best-selling book, Flatlining, Race, Work, and Healthcare in the New Economy. I thought we should bring on Dr. Adia Harvey Wingfield, to discuss some of the topics from this book and how they relate to the new work from home economy. There's obviously been a lot of change in 2020 and moving forward. So she's going to help break all of this down and how it also applies to minorities and women. So Dr. Adia Harvey Wingfield, welcome to the Work From Home Show.
Thank you for having me. I'm excited to be here.
Excellent. Well, let's start with kind of my intro and what I touched on, which is this new economy that we're living in, the work from home economy. Do you think it's here to stay? And regardless of your answer, how is this new shift in business going to affect diversity in the workplace?
Yeah, that's an interesting question. I think, well, the first thing is that when it comes to this new work from home economy, it's an economy that's still pretty segmented. And by that, I mean that it doesn't apply universally to all of us, right? Those of us who are in jobs that allow us to work from home are able to do so and are able to react to the coronavirus crisis in that way by working from our wherever we live. But there's still a pretty decent segment of the population that doesn't have that option, what we might think of in the language that we use now as essential workers. And certainly in my research, I focused on healthcare workers who would very definitely fall into that category. But there are a lot of other employees who are people who work for Amazon, people who work for the post office, people who work in the food service industries and so forth, who are people who don't have the option to do their work from home. They have to actually be on site to do it. And I think that's where we start to see some racial disparities emerge, because those jobs are ones that in many cases are disproportionately filled by people of color, who then are in positions where they are less protected from the virus, but they're also in positions where they're less able to take advantage of many of the benefits that come from being able to work from home as well. The flexibility, the autonomy, the ability to self-direct your schedule and so forth.
When you talked about the shifting and who's working from home and whatnot, right now and recently we've had a lot of parents working from home, but they also have their kids kind of schooling from home. And from what I've seen and heard, it sounds like it's impacting women a lot more than men, just because of the old stereotypical women's roles versus stereotypical men's roles. How do you think this might set back or push forward, potentially, depending on how you look at it, from an overall standpoint, women in the workplace?
Right. Well, so research is giving us some insights into that already, and the insights, unfortunately, they're not great. I mean, the data do show that given that women disproportionately are more likely to take on more of the unpaid responsibilities in a household, whether that's childcare or cooking or cleaning or the more ambiguous tasks that involve simply scheduling and remembering when someone needs to see a doctor and to buy a present for a birthday party, those types of things. That's work that has disproportionately fallen on women's shoulders. And the pandemic has only highlighted how that disparity is present in so many households. And the end result that we're seeing is that with that work being disproportionately done by women, women's productivity and women's work is really, really suffering. There was a recent study that indicated that among academics in my profession, papers submitted by women faculty members are showing a clear decline and are being hit as a consequence, presumably, of this additional work that women are doing in the home and the inability to balance that work done from home with the professional work that's necessary for advancement. So I think that it's really highly likely that one long-term consequence of the coronavirus and the time that we're all spending at home and trying to deal with the pandemic will be that it will reinforce the disparities that are present along gender lines for women in many professional settings.
You touched on the chasm between kind of the digital remote work that can be done and brick and mortar businesses. What are your predictions on what's going to happen to those brick and mortar businesses like restaurants and hair salons? Because they're in a tough spot right now.
Yeah, they are in a tough spot. I think it will depend largely on I think there'll be a lot of variation, right? So I think that I don't think this spells the end of the restaurant industry by any means. I think that's going to be one that has some staying power. But certainly in the short term, a lot of restaurants are going to take a hit. And I think we will see a lot of restaurants going out of business, unfortunately, just because the coming change in the weather, and if we get the second wave that many experts are predicting, I think that's going to make it very difficult for many businesses to stay open. But at the same time, I don't think that means, like I said, that there will be no more restaurants in the future. And I think that there'll be some changes depending on what types of business we were talking about. So for hair salons, by way of example, a previous study that I did focused on Black women in the hair business who were entrepreneurs in that field. And I actually would expect that to be an industry that has some staying power. And this is based on what a lot of entrepreneurs told me about going through downturns and tough times. Nothing like this, obviously, but that this is an industry that, for a variety of reasons related to race and gender, has a certain level of long-term stability. So I think that there will be some businesses that will take a hit that they don't recover from. But I think that in the long term, at the industry level, there'll be a lot of industries that maintain, but what they look like on the other end of this, I think still remains to be seen.
So what can we know? We've talked about how we're getting the disparity of women in the workplace, right now, and how the essential workers right now are, in more danger. What can we do to, make sure that this doesn't set us back, 20, 30, 40 years in terms of minorities and women in the workplace?
Yeah, so that's a great question, too. I think it's going to be really critical for many organizations and leadership in organizations in particular to be attuned to and adjust to the challenges that their employees are facing, right? So obviously we all know that at a certain level we're being affected by this pandemic. But I think it's going to be incumbent on managers to be attuned to what that impact actually is for their workers. For example, as we were discussing before, for women workers, the consequences of a pandemic present a certain challenge. It's extremely difficult to balance supervising your child's homework while you're also supposed to be in meetings and getting other things done for your job. But I do think that there's an opportunity for leadership to be mindful of that and take that into consideration and be flexible about what that means for when and how people work, and to keep that in mind for what it means for evaluating employees going forward. That type of flexibility and that type of innovation, I think, is going to be really critical in making sure that in the long term we weather the storms of the COVID crisis, but we do so in such a way that does not sacrifice the contributions that racial minority men and women and white women are able to make to workplaces.
We have Professor Dr. Adia Harvey Wingfield, Professor of Sociology at WashU St. Louis and author of the new book, Flatlining, Race, Work, and Healthcare in the New Economy. Dr. Wingfield, we've touched a little bit on the brick and mortar businesses, the future of work from home. It is going to be a challenge. Do you think that the federal government should take a policy such as a no worker left behind seriously now? We haven't heard any political candidate talk about this, but what do you think of such a policy, no worker left behind?
Yeah, so that's an interesting question too. I mean, my understanding is that one approach taken by other advanced democracies has been to make sure that federal government initiatives kind of pick up the load for the way that businesses may be being adversely affected by this virus, so that workers are not disproportionately or needlessly harmed any more so than they have to be, with the eye towards being kind of a stopgap measure, so that down the line, again, businesses can be able to flourish successfully and to do well. It seems like, based on what I understand of those policies, that is an approach that does seem to be one that operates with both long-term goals in mind and with the stability and security of organizations and workers in mind. It does not seem, in my viewing, to be something that we've talked about seriously or comprehensively in the U.S., and there are probably a lot of reasons for why that conversation doesn't seem to be happening right now. But I do fear that it portends an ongoing lack of awareness for and consideration of the very real plight that many workers face in a society that already was showing growing signs of increasing economic inequality, growing signs of increasing income inequality, and proceeding along a path that does not bode well for most workers' economic stability and their ability to really derive benefits from the economy in ways that reflect the work that they put into it.
Your new book is Flatlining Race, Work, and Healthcare in the New Economy. How are you expecting, we've talked a little bit about race and work, but how is healthcare going to change in the new economy?
Yeah, so that's such an interesting thing to think about. So in the book, one of the arguments that I make is that as organizations have changed to say that they want more racial diversity and that they want to be attuned to these issues, in many cases they do so without corresponding shifts to their programming and to their initiatives and their resources. And instead, what I found that many organizations do is that they say that they want more racial diversity, but they don't put any work into it. And instead, they leave that work up to the few black professionals who are in their employ. And this is a process that I refer to in the book as racial outsourcing. And I argue that in response to racial outsourcing, many black professionals find themselves doing what I call equity work, which I define as the labor of making organizations accessible, available, and amenable to communities of color, whether those include workers or, as the case may be in my study, patients. So I have to say I do have a lot of concerns, given what I found, and I did this research before COVID was anything that any of us knew about. I collected the data way before this pandemic was upon us, and the book was actually published before all that happened as well. But I have to say that given my findings that so many black workers were doing this additional labor under better circumstances, it really worries me that in a post-COVID environment, we are probably likely to see, if not a continuation of this, an exacerbation of this process of black workers doing this additional labor. So I think there's real cause for concern about where healthcare is going and what those consequences are for the few black workers who are in healthcare professions. Black workers are very underrepresented in this field. Black doctors comprise only 5% of that population. Black registered nurses are about 10%. In both cases, they are underrepresented relative to their proportion in U.S. society. So it's a real cause for concern to have people who are already underrepresented in these professions taking on additional labor. And I worry that there is simply going to be more of that as we start to grapple with the consequences and after effects of this pandemic.
You wrote in an article I read, you were talking about how black patients received better care under black providers, but white providers didn't give better care to white patients. What do you think is the cause of that? And kind of what, in your research, was there anything in particular you noticed about why the African American race showed more empathy towards the African American patients as opposed to the white providers and white patients?
Yeah, there were a couple of things that emerged from my study. So for black providers, one of the things that I found, was that they often went into the field because they were openly committed to addressing racial health disparities and creating better health outcomes for black communities. This drove a lot of my respondents in a variety of fields. I talked to a geneticist who expressed this viewpoint. I talked to a maternal fetal medicine doctor who felt the same way, emergency medicine doctors. There was a consistent desire to want to improve conditions of care for Black communities. And in some cases, that stemmed from a sense of personal recognition for the experiences that those communities face themselves, right? So I talked, for example, to a physician assistant who told me that he'd grown up very poor and had relied on publicly funded care his entire life, as a child and young adult, rather, and that experience was a big part of what drove him to want to go into the healthcare environment and to provide better, more respectful, more comprehensive and consistent care for Black communities. So that firsthand personal experience of seeing how the healthcare system can treat people and wanting to provide something better, I think is a big factor for how many Black healthcare workers see the work that they do. By contrast, they also described a lot of occasions, however, where many of their white coworkers not only did not share that experience, but did not share their same view of Black patients, particularly low-income and uninsured Black patients, as being people who deserve that kind of comprehensive, respectful, and complete care. In many cases, my respondents talked about their white coworker about interactions that they had with their white coworkers when their white coworkers stereotyped patients of color, when they assumed that low-income Black patients were simply drug users or drug abusers, that they were incapable of being compliant with instructions being given, that they had a very difficult time understanding the social context that shape the decisions that people make about health and about their options, especially when those options are limited. So those factors together, I think, help to provide some context for why we might see these disparities occurring and why we might see such a difference when there is patient-provider concordance, when there is a match between the person who is the practitioner and the person who is the patient. In a lot of cases, that familiarity with a patient's experiences, background, and sense of them as a complete person is more likely, I found among my respondents, to be present for Black healthcare providers than it was among their white counterparts. And they specifically observed the opposite among many of their white counterparts.
Well, Dr. Wingfield, it's certainly heartening to hear that at least the Black community is so compassionate in the healthcare space. Because I can tell you, in my community, I don't want to say it's my opinion. It's pretty widespread that within our community, the healthcare workers aren't as compassionate to their own. So it's you hear all the time, I want to become a healthcare worker to help people and to change the medical system, and that hasn't really hit our community on a widespread, pervasive level yet. So hopefully it'll come. It used to be like that, apparently, many decades, eons ago, back in our home country. But here in capitalist United States, it's definitely lacking.
Mm-hmm, mm-hmm.
So we've talked about how the minorities are are more visible and more, what is the word I'm thinking of? Are more represented, in the kind of essential worker path. What can we do as a society to shift the minorities into more of the work from home style jobs? Is it just about education and giving them more opportunities to go to college or go to trade school or whatever? Or how can we help move that shift?
So I think this is a twofold question. I think that there are clear systemic barriers that make it difficult to access professional managerial jobs, particularly those that are the most lucrative and prestigious in our society. And those barriers are numerous, right? There are barriers in the educational system. Once people are in workplaces, there are barriers into getting into these workplaces in the first place, but there are also barriers in these workplaces. And often people's perceptions and ideas about who seems like a leader, what types of skills people assume that workers who are different from them have or don't have, ideas about whether people have the skills and talents to be in jobs, whether or not that's actually based on real measurable outcomes. Those things are all factors that help to create some of the disparities that we see, the racial disparities in particular, in high-status professions. But I think the second part of what I think is embedded here is a question of what type of work we want to have present in our society in the first place, right? And I think a bigger question to raise, or maybe a different question to raise, is not only this question of shifting the racial disparity so that we don't disproportionately see people of color represented in essential worker jobs that are low-paying, often low-status, jobs that make it difficult to make ends meet, but thinking about why we have jobs that are constructed like that in the first place. We don't have to have jobs that pay less than a living wage. We don't have to have jobs where people can't find out their schedule until the very last minute, making it difficult, if not impossible, to maintain a consistent income and raise families on those jobs. These are things that we choose to do as a society. But one thing that I think that the coronavirus should have shown us and perhaps didn't is that the jobs that we disparage and minimize as being low-wage, unimportant jobs are often the very most essential jobs that we have in our society. These are the people who provide food. These are the people who cook our food. These are the people who make sure that we get to where we have to go. We could treat those jobs a lot more fairly and a lot more equitably and provide a lot more support and resources and benefits to those kinds of jobs than we're doing now. And I think that on top of shifting the dynamics so that there's more racial representation among higher status professional managerial jobs, we also need to take a long, hard look at why we treat people in certain jobs in such a damaging fashion and why we allow those jobs to be ones that continue to be ones where people work very hard but don't necessarily see equitable rewards from the work that they are doing, particularly given the importance of those jobs in the bigger scheme of our society.
One of the things we've talked about numerous times on this show is how we think that as more jobs and more work is done from home, it will become a lot more of a results-based situation where, it's not whether you're in the office and present for 40 hours, but it's going to be more, did you get your work done? Because you obviously, when you're working from home, they can't always tell, when you're working, when you're not. So do you think something like that and having the results of workers working from home clearly shown will help get minorities and the like moving up in the company, just because they're not necessarily being overlooked as being like, oh, well, she was under this man, and so we're going to promote him. But you can see these were her exact results, and so we should move her up into this role?
So that's interesting. I think that there's the possibility for these kinds of changes to become more embedded in some workplaces. And even before this, there certainly were efforts in various organizations and various settings to try to make these types of cultural and organizational shifts so that people could work from home more effectively. But I think whether that leads to more racial parity, which I think is part of what you're asking, isn't something that's going to happen by accident. I don't necessarily think that just shifting to a model where people are able to work from home and managers are driven to focus more on results than on face time and how much time people are putting in the office and the more social components to how we work. I don't necessarily think that automatically will lead to more racial parity. I think that organizations have to be mindful and intentional about making sure that the often unspoken, taken for granted everyday practices that allow the important contributions of people of color and white women to go overlooked. That has to be a critical part of organizations and managers' intentional missions, right? Because I think without that, it's still too easy. And again, data document this, right? That in organizations that have a strong focus on purporting to be a meritocracy, it's easier to overlook and to disregard the ways in which non-meritocratic practices happen to the detriment of groups that are often underrepresented. So I think that a focus on results and a results-oriented culture is very valuable, and that's very important. And the data, again, do show that can really make a difference in a lot of workers' experiences. But simply implementing that without also being attuned to how easy it is for managers to overlook the contributions of underrepresented workers, I think is not going to necessarily make those changes for those underrepresented workers.
Dr. Adia Harvey Wingfield, Professor of Sociology at WashU St. Louis, President of Sociologists for Women in Society, a national organization that encourages feminist research, and author of No More Invisible Man, Race and Gender in Men's Work, and the new best-selling book, it's on Amazon and all bookstands everywhere, Flatlining, Race, Work, and Healthcare in the New Economy. Dr. Wingfield, any final thoughts you want to share with our listeners or anything else you want to promote or plug?
This has been a great discussion. I think the only thing I have to add is that my term as president of Sociologists for Women in Society actually ended. So I'm not actually president of that organization anymore.
That's fine. You're the former president of Sociologists.
Yes.
Right. Okay, good, good, very good. Well, go to Amazon. WashU's website is wustl.edu. Great school, really good school. Didn't get in the first time around, got in the second time around for graduate school. So, Dr. Wingfield, thanks so much for coming on the Work From Home Show. We greatly appreciate it. And to all of our listeners, check out this episode and all of our previous episodes. Share it with your friends. Visit our website, workfromhomeshow.com. That's workfromhomeshow.com. Email us if you have any questions, hello@workfromhomeshow.com. That's hello@workfromhomeshow.com. And until next time, keep on working from home.